First, I want to say I have a great deal of personal respect for the author of this bill, and I did warn her last night that I have a different perspective on this particular topic. I want to thank the moms and the beneficiaries of these services and the medical professionals that are here. Because of conversations like this, I think crisis pregnancy centers have wrongly been targeted for violence. These centers have had to shut down because of security concerns. I'm thankful for these centers. I'm not a scientist. I can't really debate the reversal medication situation. I really don't know. All I know is I've met a lot of these women and these families that have benefited from their services, and I take complete offense to calling them fake health centers. I take offense to you calling the licensed doctors, the nurses, and other medical professionals as fake. The women who had abortions and have gone through these centers and have used services of Planned Parenthood and the crisis pregnancy centers and attacking them is not appropriate. It's false. They cannot provide data with whomever they want. Just heard a bill in privacy just now where I serve as the vice chairman, and there's actually legislation up right now to make California's already strong privacy laws that are landmark legislation even stronger to protect women who are coming in from out of state and deciding to have an abortion here. And so it's not accurate to say that they can share personal information, and if they're doing that, that's a violation of already existing law. You just described an example of a situation in Reading. I don't know anything about it. I tried to Google it, couldn't find anything about it, but let's assume it's true. And it sounds like to me if it was shut down that the law took care of it. There are bad actors in a lot of fields of study, a lot of different kinds of situations, and I'm not going to paint a broad brush. But very soon I'm going to an event in my district with literally hundreds of families that are going to be supporters of one of these centers in my district. And it isn't because they're fake. It's because they're actually benefiting my community and women who've benefited from this service. And so I wrote my comments as I was sitting here listening to this because I think the mischaracterization of these centers throughout the country has been really problematic to me. I've seen what they've done. I've seen the women who've benefited from them. And if we want to have a discussion about the types of things that they can do, I think that that's fine. But giving this legislation, in my opinion, paints them with a broad brush. And I definitely cannot support this legislation as a result.